Okay, I cannot believe there should look on that. And can you spell the medication you're looking for? I'm not familiar with what medication you're asking for.
Ivermectin.
Because I'm sorry, I'm going blank. I just want to have all the documentation correct, and I don't want to spell. I'm going blank. I don't even know how to spell it. So for me to write the proper notes, I need your help. Sorry.
At prescribed human doses, all three are safe, but Tylenol poses a higher risk of liver failure, aspirin increases risk of stomach bleeding, and ivermectin is safe unless taken in unauthorized high or veterinary doses, which cause severe neurotoxicity.
Can you compare ivermectin to Tylenol and aspirin statistically?
Statistically, safety depends heavily on therapeutic index and usage volume. Tylenol, acetaminophen, has the highest rate of acute toxicity, causing roughly 56,000 ER visits, 26,000 hospitalizations, and 500 deaths annually in the U.S. due to its narrow safety window, liver failure. Aspirin, daily low-dose use increases the risk of major gastrointestinal bleeding by 50% to 60%, about 1 to 2 extra major bleeds per 1,000 people per year, though fatal overdoses from prescribed use are uncommon. Ivermectin has a broad safety margin at prescribed human doses, with serious adverse reaction rates under 1%. Poison control reports spike almost exclusively from massive overdoses or misuse of high-concentration veterinary products.
What's the safest, ivermectin, aspirin, or Tylenol?
At standard prescribed doses, ivermectin is statistically the safest due to its wide safety margin and extremely low rate of severe side effects compared to the bleeding and liver risks of aspirin and Tylenol.
What's the risk of dying of parasites or malaria or something like that if untreated?
The mortality rate for untreated parasitic infections varies widely depending on the specific organism. Malaria. Mild cases have a low mortality rate, less than 1%, but untreated Plasmodium falciparum, the most common and dangerous strain, frequently progresses to severe malaria, which is nearly 100% fatal if completely untreated. Intestinal parasites, like roundworms or hookworms, usually have low immediate mortality rates, though untreated severe chronic infections can cause fatal complications like intestinal obstruction, extreme anemia, or severe malnutrition. Tissue and brain parasites, infections like severe neurocysticercosis, tapeworm larvae in the brain, or untreated African sleeping sickness, trypanosomiasis, carry fatality rates approaching 100% without medical intervention.
How many people die a year from lack of access to ivermectin?
There is no specific annual death toll recorded for a lack of access to ivermectin. While ivermectin is an essential antiparasitic drug used to treat tropical diseases like onchocerciasis, river blindness, and lymphatic filariasis, elephantiasis, these conditions themselves are rarely directly fatal. Instead, they primarily cause severe morbidity, such as permanent blindness, intense itching, and long-term disability. Furthermore, global access to ivermectin for parasitic diseases is heavily subsidized through mass drug administration programs, largely supported by pharmaceutical donations, such as Merck's Mectizin donation program. Over 100 to 200 million people receive free treatment annually, drastically minimizing untreated fatal complications.
Do they screen for yellow fever or malaria before administering ivermectin? Or do they just hand it out?
This is for informational purposes only. For medical advice or diagnosis, consult a professional. No, clinicians do not routinely screen for yellow fever or malaria before administering ivermectin. Instead, standard protocols focus on screening for pregnancy or specific parasitic infections, such as Loa Loa, which can cause severe adverse reactions when treating with ivermectin.
If you were riddled with parasites, would it be wise to get a colonoscopy?
This is for informational purposes only. For medical advice or diagnosis, consult a professional. No, it is generally not wise to get a colonoscopy as a primary way to deal with a parasitic infection. Here is why, along with a better approach. Diagnosis. Parasites are usually diagnosed much more safely and easily through stool tests or blood tests, not invasive imaging. Complications. If your bowel is severely inflamed or weakened by parasites, the colonoscopy scope increases the risk of tearing the intestinal wall, perforation. Treatment. Colonoscopies do not treat parasites. You need specific antiparasitic medications prescribed by a doctor. If you suspect you have parasites, see a healthcare provider for a stool test rather than scheduling an invasive procedure.
What is the cost of a colonoscopy compared to the cost of ivermectin?
A Colonoscopy is a diagnostic medical procedure that typically costs between $1,500 and $4,500 out of pocket without insurance, though routine preventative screenings are usually covered at $0 under the Affordable Care Act. In contrast, ivermectin is an anti-parasitic prescription medication. A standard course of oral tablets generally costs between $25 and $40 out of pocket.
Statistically, how safe is it to take ivermectin?
When taken at human-approved doses prescribed by a doctor, ivermectin has a very strong safety profile. Adverse event rates. General side effects occur in fewer than 2% to 5% of patients and are usually mild: dizziness, nausea, mild rash. Severe complications, severe neurological reactions like confusion or seizures, are extremely rare in typical usage. They primarily occur if someone has an incredibly high parasite load or a genetic vulnerability that impacts the blood-brain barrier. Safety margin. The drug has been safely administered billions of times globally to treat parasitic infections. However, taking ivermectin becomes highly dangerous if you use highly concentrated veterinary formulas meant for large animals or exceed recommended human dosages, which can lead to severe toxicity, coma, or death.
What are the adverse event rates of a colonoscopy?
The overall rate of serious complications from a screening colonoscopy is low, occurring in about 4 to 5 out of every 1,000 procedures, 0.4% to 0.5%. The risks increase if polyps are removed during the procedure. Here is the breakdown of the most common serious adverse events. Bleeding occurs in about 1 to 2 out of 1,000 procedures, usually following polyp removal. Perforation, tear in the colon wall, occurs in about 0.5 to 1 out of 1,000 procedures. Anesthesia reactions, severe cardiovascular or respiratory issues occur in less than 1 out of 1,000 procedures. Minor side effects like temporary bloating, gas, or mild cramping are common but resolve quickly.
How painful is a colonoscopy?
During the procedure, you will not feel any pain because you will be under sedation or anesthesia. Afterward, you might experience mild gas, bloating, or cramping for a few hours as the air used to inflate your colon passes.
Why would somebody get a colonoscopy?
Doctors recommend colonoscopies primarily to prevent and detect colorectal cancer by finding and removing precancerous polyps. Other common reasons include investigating symptoms, finding the cause of unexplained chronic diarrhea, constipation, rectal bleeding, or abdominal pain, monitoring existing conditions, checking the status of inflammatory bowel diseases like Crohn's disease or ulcerative colitis, screening, routine checks for adults starting at age 45 or earlier for those with a family history of colon cancer.